Hello everyone. So today we're gonna talk about the Corynebacterium diphtheria. Okay, so we will just cover the for first step USMLE. We're just gonna cover what is important. Okay, so this we are talking about our Corynebacterium diphtheria. Okay, so we know that the patient comes to us with a feature of some kind of membrane in the pharynx area. Okay, so that's what a patient is typically presented with, and patient might present with some kind of heart problem, rhythmic problem, or some kind of like neuropathy. So that then we will gonna discuss about it. Okay, then we're gonna see further. So let's just start. So basically the Corynebacterium diphtheria is actually gram positive rod. Okay, so we know that it is our gram positive rod. Okay, and what else, it is club shaped. Okay, that is also very important, that it is club shaped gram positive organism, and it forms some kind of angular pattern. Okay, angular arrangement is there, angular pattern is there. Okay, and what one more thing, it is transmitted by the respiratory droplets, means simply we can say our droplet is getting transmitted. Okay, now it's caused by what, it caused by our exotoxin, right? And typically what this exotoxin is, it's this exotoxin, it is encoded by beta propase here, right? So this exotoxin is encoded by beta prophase, and this exotoxin is responsible for the Corynebacterium diphtheria symptoms. Okay, now what else, this potent exotoxin, what exactly it will do, it is encoded by beta prophase, and what exactly it do, that it inhibit the protein synthesis, right? So mostly bacteria, for example even the clostridium, they also inhibit some kind of like protein activity. So over here also they are inhibiting the protein synthesis. By which mechanism? So they will inhibit this protein synthesis, means the formation of the protein they will inhibit by what? They will inhibit by the help of the ADP ribosylation. What? ADP ribosylation. By the help of ADP ribosylation of what? Of elongation factor 2, right? Of elongation factor 2. Okay, now what is happening, that now what is this bacteria exactly doing? See, this bacteria is what, it is causing certain features which I have told. Okay, it can lead to the necrosis. Yeah, it can lead to necrosis in pharynx, right? Okay, we have talked about it. And in cardiac also it can lead, in CNS also it can lead. Okay, so these things are happening. So what is this Corynebacterium diphtheria? It can cause to necrosis. Where it can cause? It can cause in pharynx, or maybe heart, or like CNS. So heart and the CNS are like a most important system of our body, isn't it, right? So with that we can consider pharynx also, right? So it called necrosis over there. Okay, that's what we need to know over here. Now if we move forward, we see that there are certain symptoms which I've already talked about. Okay, let's gonna see over here. Okay, like this, I hope you guys are able to see properly. So it will gonna cause certain, this Corynebacterium diphtheria will gonna, which is club shaped and all, it will gonna cause certain symptoms. So what symptom it will lead to? Number one, it can cause the pseudomembrane. See, I have told you in the starting, then it will lead to some kind of grayish membrane, some kind of pseudomembrane. Okay, so that's why we are saying in the pharynx, that's why we are saying it's pseudomembranous pharyngitis, right? Terms might be like, sounds like difficult, but it's very easy, right? There's the pseudomembrane in the pharynx, that's what it means, pseudomembrane pharyngitis. Okay, what exactly is this? This is some kind of membrane, we can say, which looks like grayish in color. Okay, grayish whitish membrane in color, right? What else? With this there will be lymphoadenopathy also. Yeah, lymph node will also get swollen up. Okay, so there will be lymphoadenopathy also. That's why the patient is presenting with this membrane, plus the patient is presenting with what? It is presenting with bull neck appearance, means the neck is kind of bulging just like a bull. Okay, so these two features will be a presentation of the Corynebacterium diphtheria, which you should know. Okay, and why there is bull neck? It's because of lymphoadenopathy. ठीक है, okay. Then what is that? Now let's talk about further. If we talk about further, we talk about this toxin. Now what happened if this toxin got dissemination? What does it even mean? See if this toxic got dissemination, just for understanding you can say, like for example, it just getting spread it more, right? Okay, something like that. So it what it will do if it spread more, it will cause what? It will cause the myocarditis, that is inflammation of the myocardium layer of what, of the heart, right? And it can lead to arrhythmia also. Okay, why? Because it's affecting the heart itself. And it can lead to certain neuropathy also. Why? Because it is affecting our brain itself. We have just talked about it, isn't it? Now how we will diagnose? Okay, we know that the patient has come with the Corynebacterium diphtheria clinical features. Now for diagnosis we will do the lab diagnostic. ठीक है? So lab, what is lab diagnosis? Sorry for the meaning of ठीक है. It's just means okay, is that all right? It's mean in like Hindi. Just ignore that. Okay, it's my habit. So anyways, if we talk about this lab diagnosis, so the lab diagnosis is basically based on what it is based on the gram positive rod, because exactly this bacteria is nothing but a gram positive club shaped rod. Okay, so we will just diagnose it by the help of what? By the help of the metachromatic granules. What does it even mean? See, these rod like bacteria, they have metachromatic granules. This line is very important. These metachromatic granules are actually the bluish as well as the reddish granules. Okay, what are these are bluish or like reddish granules. Okay, or like the bacteria. So that's what we say, it is kind of like metachromatic granules. It have metachromatic granules. Okay, so in the lab diagnostic we will see that, and we will also see that it is gram positive rod. And one more thing is that there is like elect test will be positive air for the toxin. Okay, for finding out the toxin we are doing this test, and this test is positive. Now for the prevention we will just gonna give what? We will give our toxoid. Okay, why? So because the toxoid consists of the vaccination against the diphtheria also, that's why. Okay, so that will prevent it, right? They prevent diphtheria. Now for mnemonic, if you guys want to know, let's just see firstly over here. This book is exactly for USMLE step 1 and 2024 latest edition, right? And it will gonna help you. And guys, don't take international one, just take the normal one, which normally the USA children often use. Okay, so let's just continue about it. Right now, if we talk about the Corynebacterium, I have told it is club shaped bacteria. What does it even mean by club shaped? See, the club should not take nothing like some kind of like this. Okay, sorry, my drawing is not good, but whatever. Okay, so it is club shaped, it has metachromatic granules, and one more thing, on the loafer medium. Okay, on loafer medium, you can search on Google also on loafer medium. You can easily able to see this metachromatic granules. Okay, so that will be easy for you after that. And also we can use this cysteine telluride agar, in that we see the black colonies. Okay, now for mnemonic we can just go A B C D E G. What does it even mean? C and D means Corynebacterium diphtheria, isn't it? Corynebacterium diphtheria. Okay, then this beta prophase we have read it somewhere where, see here we have read it is encode the exotoxin, right? And what is happening, this ADP ribosylation also it's done of elongation factor 2 for inhibition of the protein by what? By this exotoxin. And it has this angular arrangement over here, which I have told already, right? And it can spread by droplet, and elongation factor 2 plays a role, has exotoxin, has granules. So these all we have seen. For treatment we are just going to give antitoxins, right? With that we will give erythromycin and the penicillin. Hope you guys like my video, and if you really like my video and really feel helpful, please do subscribe my channel, because I will upload it daily. And if you guys will subscribe it and maybe like it if you like it, and just comment me what is not right, what you didn't understood. Okay, what's the problem, what concept you didn't get, just tell me directly on the comment, right? I will try to fix it for sure. This video are completely free, and all the best. Thank you.